Show. I have been a student of Dr. Osibov's this past semester in health communication. I believe that our health status is an important part of determining how our quality of life is at any given time. Yes, genetics and physical makeup do play a large role in the equation of our quality of life, but there's also the oftentimes hidden component of health communication, and it is all around us. And good health communication allows us to teach, learn, and grow as human beings, and it helps us aim to sustain a quality of life that is worth living. So, my name is Crystal Robichaud. I held a Bachelor of Science in Health Services Administration degree. As a professional, I work in forensic healthcare, working with victims of sexual assault and domestic violence. I am a student of the Master's in Science degree at the University of Florida in Health Education and Behavior. And as previously stated, I am a student in health communications this semester. So I have gained a deeper understanding of how health education and health communications can impact the outcomes of the health of special populations, and specifically the ones that I focus on are patients of victimization and trauma. And so after taking this health communications course, I am very excited to use what I have learned to further promote health, wellness, and holistic healing within the population of trauma patients that I work with. So my health philosophy builds on the foundation that self-care education is essential from very early in life. So we as humans know how to and learn healthy ways to care for ourselves on a daily basis. The daily choices that we make, such as what we eat, how we our diet, our physical activities, our recreational activities, how organized or clean our homes are, what we expose ourselves to as far as stimulants and art forms, and how we have and maintain relationships with other people, other groups, and other organizations, etc. All these factors do have an effect on who we are and how we are able to care for ourselves, and ultimately this has an impact on our overall health. So I believe that health communication is a large portion, has a large part to do with reaching the public in how to make healthy life choices in our activities of daily living. Along those lines, I also believe that health communicators and health educators have to have a significant amount of emotional intelligence for the ability to understand human emotions and the context of where these emotions stem from. I believe that enables communicators to be able to create education and communications that are impactful and effective. Empathy is also a very important component in successful health communications as well, because with empathy and emotional intelligence, we are able to think critically and think deeper about the specific needs of different populations. So for me, patient autonomy is one of the most valuable components in healthcare and in health promotion and health communications. Autonomy enables individuals to feel like they are capable, and it enables them to be confident in their ability to make informed choices about their health care, and their medical treatments. Autonomy is gained by having the knowledge and the ability to communicate with your healthcare professionals. And this can all be garnered by relevant, culturally significant, and emotionally intelligent health education and communications. So, in closing, for my health communications philosophy, promoting foundational level health education focused on emotional intelligence and patient autonomy supports a strong health communication philosophy. Being armed with the knowledge necessary to make healthy choices of daily living and having autonomy over health and medical choices can motivate individuals to make their health a priority. And we tie those things back into a strong foundation and appropriate health communications. So my cover letter covers the general, my general experience as being, having varied jobs in the field of healthcare over the past 10 years. I am professional positive and always up for solving problems. And I do possess many skills, lots of education, and lots of experience. And that qualifies me to perform a job as a health educator and health communicator. I have a bachelor's of applied science in health administration, and I will be graduating with a Master of Science in Health Education and Behavior next semester. I will also be sitting for the National Certified Health Education Specialist exam as part of the graduation requirement. And so all of this education and my experience gives me the expertise on research methods and public health program development, as well as the ability to be an effective health communicator. And I can also tackle any health-related topic from the education that I've received and make it relevant to this company. And so on top of my skills and education and experience, I am personally very passionate about health and wellness. And I believe all of these factors together make me an upstanding candidate to work as a health educator and or health communicator. So next is my resume, as I currently am a forensic healthcare program assistant, as an assistant care coordinator and a forensic assistant, forensic technician. My objectives explain that I am a seasoned healthcare professional with many years' experience. My passion and education, and my belief in patient autonomy and delivering high-quality health care. My education, Master of Science in Progress, Bachelor's, Associate in Science, and I used to be a massage and bodywork therapist a medical massage therapist for the better part of 10 years. My experience, as you can see, for the last 2.5 years, I have been a forensic healthcare assistant. Before that, I was a nursing assistant for 2 years. And then before that, I was a medical massage therapist for 10 years. Moving over to my portfolio, the first communication that we turned in was focused on the socio-ecological model application, and I chose to focus on sleep disorders among college students. So as a college student straight out of high school, as a freshman, you are adjusting to a tremendous change in your life, and you are now responsible for yourself. You have heavy course loads. You have to learn how to balance your social life and your school, and possibly work if you are a student that has a job on the outside as well. All of these factors can lead to having sleep issues and the development of sleep disorders as a college student. So the American Psychiatric Association just defines the sleep disorder as having issues with timing, amount, and quality of sleep. These things can lower your function during the day, can also cause physical and mental health conditions under continuous continuous conditions. So some of the concerning side effects for college students that we see with sleep disorder are depression, symptoms of ADHD, like lack of concentration, irritability, increased tension, confusion, overall decreased satisfaction with your daily life, and a big one, as you are in studying at the university level, it can have a negative impact on your academic performance. So development of poor sleep habits that aren't corrected can lead to serious health conditions later in life. And this includes high blood pressure, diabetes, heart disease, obesity, among others. So the indication, the research does indicate that public health interventions are necessary. Are necessary to help students who are impaired by sleep disorders. Let's see. So in some individual level forces for this, common behaviors: caffeine intake, energy drinks, alcohol, your choice or lack thereof of physical activity, whether you smoke, whether you stay out late in social settings, extensive nighttime media use. It can be difficult to regulate these behaviors. And because of your newfound freedom and the minimal supervision. So you have to, as a new college student or as a young adult, have to learn to be responsible for yourself and the choices that you make and how they affect you and your sleep. So relationship level forces for college students. You can have changes in personal relationships, especially friends and family that you had growing up and in high school. And that can be a big transition and cause some drastic changes. Those can lead to stress, emotional issues, and increased stress, inner sad, or negative emotions are strongly correlated with sleep disturbances in college students. Developing new relationships with college peers can be anxiety producing, and these things can lead to overall mental health issues that correlate with poor sleep. So community level forces with with sleep disorder in college students. You have new and exciting opportunities at the community level. There is fraternities, sororities, sports and social clubs, dorm life. And research shows that common mental health issues, including depression, anxiety, panic attacks, and chronic sleep issues, are found to be common within fraternities and sororities or the Greek life communities. I know that personally, living in a dorm can greatly affect your sleep and your desire to go to bed at a decent hour. Societal level forces. Developing new relationship with peers, increased social and academic pressures. They factor into sleep deprivation and disorders in college students. And social norms of binge drinking in college, being social into the early hours of the morning are prevalent. And these are also things that can affect your sleep in a negative way. So, as college years are a great time of transition and growth, any great life change can cause mental health concerns and development of unhealthy behaviors. So I believe that there should be a health communication and health education programs in place to help prevent sleep disorders in college students so they can have optimal function and learning. So this is just one health communication example from the National Sleep Foundation. This illustration focused on sleep hygiene and things that you can do routinely to develop a healthy routine at night to promote healthy sleep hygiene. So balancing a healthy weight, this communication gives you 3 steps to follow. Balance, which is balancing your diet, having a varied diet of fruits and vegetables, and getting the right portions of a variety of foods. And then your step 2 is your physical activity. And then there are some ideas for physical activity and how they benefit. And then also enjoying certain foods in moderation. And this all promotes an initiative for balancing healthy body weight, because in the U.S. it is projected that 1 in 2 adults will be classified as obese by the year 2030, and that is a public health issue that we need to that definitely needs to be addressed. So this communication was based off McGuire's hierarchy of effects. So we needed to gain and maintain the attention of the audience, put your strongest points first, provide a clear message, and the action that you are suggesting should be reasonable and easy. Provide good evidence and use credible sources. So following all of these 12 steps, the 12th one is applicable. So I chose a health issue that is common among college-age students, and that is the transmission of the sexually transmitted diseases or infections. So I just promoted talking about it. We're all adults. Sex is a normal, healthy part of life, and there's no reason why we shouldn't promote it being a normal, healthy part of life, because the taboo around it is what keeps us from being open and honest about it. So talk with your partners about it. Use protection. Have knowledge of sex and the potential consequences that could come from it. Pregnancy, STDs, and so you can identify the signs if that is something that you are at risk for, and also get tested. And so the initiative would promote that testing is available on campus at the Student Medical Center. So this one is for audience segmentation, and I chose to focus on academic burnout in college. I chose a few different populations, so this one is my general. This one focuses on freshmen, the changes of a few things to do. And upperclassmen burnout. Not sure some of the symptoms, signs and symptoms are a bit different than in lower classmen. And then grad school burnout. So not saying that a undergraduate degree is not stressful, but the research shows that high levels of stress are increased in grad school, and moderate to severe anxiety or depression can be some of those symptoms. But I know from personal experience that I am much older with adult responsibilities, trying to be a graduate student at the same time. So it can be quite stressful, but along with the other subgroups, we just exercise time management, set our goals clearly, utilize our advisors, because that's what they're there for, is to help us navigate through the tough times and help us make a plan. And then here are healthy behaviors. Prioritize sleep, be active and eat healthy, be mindful, try and be in the moment. Spending time in nature is good for a lot of things, but reducing stress is shown to be one of them. And then you have resources to talk and to help, and open up to your friends if you need it. So this is a logic model for cervical cancer awareness and prevention in college-age females. So here the inputs are listed of the things that you may need. We'll read across the first line, for example. So the activities are to educate campus healthcare providers and clinics about program details. The output of that would all campus providers and clinics receive an in-service on the program details. The short-term outcome of that would be to increase provider and healthcare workers' awareness and participation in the program, and to increase the midterm outcomes are to increase cervical cancer screening, and the long term is prevention of cervical cancer. And we will do one more activity. So organize HPV vaccination clinics. This is an amazing idea, and we actually do work with. I actually do work with clinics where we have one day a month where we do a PAP clinic for women's wellness exams, and our numbers for being in compliance with preventive health measures, it does make a difference and it does help. So, HPV vaccination clinics offering free HPV vaccines as the output, as they said they would be made available to all university students. The short-term outcome of HPV vaccines, would be HPV vaccines offered on a walk-in basis at specific clinical times throughout the school year. Midterm is to increase HPV vaccinations, and then long-term prevent cervical cancer, safe sex practices, and increase knowledge and concern for women's sexual health and well-being. So this is a patient communication where was a scenario that was not ideal for a patient who had had surgery and his incision site became infected. And he went back in for another surgery to repair the damage that had been done, and then the situation turned more complicated. This is a example of how, as a health communicator or a healthcare worker, you would communicate this situation with the patient, the wording that you would use, the empathy, and the language that you would use to really put some thought process into if you were that patient in that patient's shoes and you had to be out of work for 2 months longer than you had anticipated, and how this is going to impact you. How would you want a healthcare worker to handle that when they're having this conversation with you? So to create a few school index materials, I focused on the elementary school that I actually attended when I was in the 2nd and 3rd grade, J.W. Seabook Elementary in Cumberland County, which is my hometown. And because the school participates in School Psychology Week, I chose to focus on acts of kindness to promote empathy, positive feelings in school-age children. So I just put a few simple acts of kindness that are easy to follow and easy to do at least once a day. Hold the door open, offer a smile, give someone a compliment, and lend a hand when you're able. So I also chose to focus on the scores of math and reading and science at JWC are just slightly above the 50th percentile. So those could be improved. And one initiative I put in place was the Choose Movement Challenge, because physical activity is shown to increase concentration, blood flow, promotes better sleep, and all of these things in combination can be helpful in improving a child's ability to learn and do well on their test scores. So I give a few options just to walk, stretch it out, do a little cleaning, or do a project, and then play. And the challenge is to do these things for an extra 30 minutes a few times a week. So this worksite health promotion focuses on an editorial company in Durham, North Carolina. And in the editing field, there's a lot of computer work, a lot of sitting, and this can cause posture problems, muscle and joint pain, and aches. It's good to get up and move. So, this health initiative at this workplace would be called Move While You Work, and participants would be offered a sit stand desk that they could transition from sitting to standing, have a little bit more movement and blood flow, increased blood flow. They would also be offered um, a posture ball, a yoga ball, as an office chair. This helps strengthen the core, it helps improve posture and decrease pain. And then we just have listed some of the benefits of participating in the program, which would be the ability to move while you work, um, decrease headaches and body pain due to poor posture, and stress on the upper part of the body. And research showed that there was improved employee satisfaction and improved workplace morale. And so the goals from this program would be to improve posture, reduce body pain, relieve tension headaches, and increase morale and job satisfaction. And also the benefit of enjoying better work quality. So, in summary, I will leave you with a few quotes that I live by daily, and these are two of my favorites. A candle loses nothing by lighting another candle, and that couldn't be more true. If you have a light and you have positivity to share, you sharing that is not going to take it away from you. It'll only make the world a brighter place. And then, of course, from good old Dr. Seuss, you have brains in your head and you have feet in your shoes. You can steer your head any direction you choose. It's your life. And fortunately, we as Americans have options. And when I'm having a bad day, or if something's not going as well as I planned, then I just look at this quote and say, you know what? I can change this direction because I'm capable. So, in summary, I am very passionate and dedicated to health and wellness. My professional and personal experiences have led me to be in the healthcare field for the foreseeable future. During this communications course, the things that I have taken away from learning for my career, the importance of knowing the receiving audience, how to tailor the message to reach the audience that you're speaking to, and the necessary structure of the message required to make it impactful and to make a difference. And that can be quite challenging working with trauma patients, but it's very interesting, and this is work that I will continue to do. I'll take these elements that I've learned along with many others throughout this course, and I will continue my goal of developing a trauma-specified program to focus on the health and well-being of victims of trauma.